from 6 News Studios with live, local breaking news where you live and your hour-by-hour forecast. This is 6 News, live at midday.
We hear it all the time. You never get a second chance to make a first impression, and having a good smile is a big part of that. No one knows that more than a dentist. That's prompted Christopher Stanosheck, who's a dentist here, to get involved with a program called Change a Life by Changing a Smile. Dr. Stanosheck is here today with details. Christopher, thanks for coming in.
Thank you very much.
All right, Dr. Stanosheck is also joined today by Mary Whitney, who is last year's recipient of this wonderful program. We're going to show you the before and after pictures in just a minute. We're also going to talk about this, which is a device that can help people, I guess, detect cancer, right?
Yeah, the oral cancer screening device. It's kind of the latest thing out there right now, early detection.
Good. Okay, let's start with the program, though, because this is exciting for a lot of people, Dr. Stanosheck. Sure. Tell me how the program works. Is this something where anyone can get involved?
Sure. Change a Smile, Change a Life started about 3 years ago. And what had started to happen is we started getting a lot of patients in whose mouths were in pretty bad shape. They were having, you know, boy, if I really could just have that beautiful smile, how my life would be different. And we felt that what a better way to give back to the community by doing by using our trade and our talent in order to do it. It's very easy for someone to write a check and give it to a charity and say, hey, this is you know, here's the way we're giving back. We felt it was a perfect fit for us to use our trade.
Yeah.
And so that's where Change a Smile, Change a Life came from. And what we started to do, we came up with kind of a neat way that if in order to nominate, say, for instance, an individual that you feel his life would be changed if their smile was changed. And so we started taking nominations, and we opened it up very, very small at first. And it's over the past couple of years, it's blossomed and it's grown. And so, you know, we're receiving 50 to 100 nominations a month now, which is great. So, so nominations started in October, and they will go until November 30th. And you can access all that on our website.
Okay, we have the website and all that information for you in just a minute. Mary, we're going to put the before and after pictures as I ask you how it has changed your life.
Oh, it's wonderful. I work with the Public Dental Quest Center, Omaha, Holland and Northam, and I get so many compliments on my smile now, and I'm not afraid to smile now. You know, I truly would close my mouth all the time when I would smile, and I don't need to do that anymore. Now I have to make myself aware of the fact that I can smile. Sometimes I'm just so used to closing my mouth.
Right, you had trained yourself that
absolutely.
I hope no one tells me a joke today because I really don't want to have to smile. And you're right, the smile did come out beautiful.
It's
you did a
gorgeous.
good job with her, Doc. A wonderful program. We're going to show you all again how you can nominate someone in just a moment. But here's the before picture that we talked about. This was last year, and then the after picture, if we can show that. A beautiful smile. So a great piece of work there, and there's plenty of people out there in the community who could really benefit from this. As you mentioned, working with the public really makes it a forefront for you. And Chris was talking about, Dr. Stanosheck, that there are a lot of people out there who are already being nominated. We're going to show you how to do it in just a minute, but I want to get to this because this machine can save a life.
Yes.
Talk to us about this.
This is the Velscope, and this is kind of the latest instrument in early oral cancer detection. Oral cancer is a disease that affects about 30,000 people a year. It kills about 8,500 individuals of which it afflicts. The disease itself has a mortality rate of about 50% after 5 years. So it's a very, very serious disease. Unfortunately, what a lot of people don't realize is that your dentist is the one who is supposed to be looking for oral cancer. Yeah. They are the kind of the first line of defense in oral cancer. Anyway. Traditionally, what they have done when you go in and see your dentist is they will lean you back. They will use a mouth mirror and ambient light in order to detect anything that just doesn't look right, any lumps, bumps, lesions, anything like that. Well, unfortunately, most oral cancers are caught, say, stage 2 or stage 3. And with a disease that has a mortality rate of 50% at 5 years, we need something that's going to be able to detect them at a much earlier stage.
Okay, and that's where this comes in.
And that's where the Velscope comes in.
All right, and we have some screenings throughout the year. We have some information for folks that we can show them right now. Nominations for this Change a Smile, Change a Life program, we have all this combined into one today. But all of the information about the screenings, all the information about this program, Change a Smile, Change a Life, are all on Dr. Stano's website. Stano, that's easier than Stanosheck. How come everyone else gets Stano and I get Stanosheck? Probably because I have to say Sidelecky all day. Doctor, thanks for coming in. Really appreciate it. Mary, pleasure to meet you. And you're right, you do have a beautiful smile.
Thank you very much.
Matches the rest of you very well.
Oh, thank you.
All right. Thanks for coming in, guys. Got everyone blushing up here. Still to come, a final check on the afternoon forecast with Andrea.